There was nobody talking for kids. So there needed to be some group that would address those factors that really matter when it comes to child health.
If we're going to influence decision makers, whether they're at the legislature, whether they're in boardrooms, whether they're at school boards or school principals or school superintendents, all of those people have to be influenced by good information.
Voices provides substantive, evidence-based research to legislators and to the executive branch on matters of public policy that directly affect children and families in the state.
Has it represented the interests of kids effectively? I think so. Has it done a good job in the legislature? I think so. Has it done a good job research in terms of tax-related issues and many others? I think so too.
American cheese. I think I gotta sneeze. I chew, bless you, and freeze.
The 50th ranking was a sad day for New Mexico. Voices for Children did not want to stay stuck in the problem, but rather wanted to stay more positive and focus on solutions of what New Mexicans, we collectively could do to turn that around. So we looked at the report, and it's made up of 4 domains. Economic well-being, health, education, and family and community, and looked at the 4 indicators under each and came forth with a set of policy solutions. It's not totally comprehensive, it's not the perfect package by any means, but it's a starting point. And we want people to look and see how their work aligns to that. And all of us collectively, the legislature, the governor's office, various state agencies, city, county governments, public schools, nonprofits, all of us to look at how we can address these issues collectively for New Mexico's children.
The first domain is economic well-being.
This domain consists of 4 indicators: children in poverty, children whose parents lack secure employment, and children living in households with a high housing cost burden, teens not in school and not working. Here's the extent of the problem. 31% of New Mexico children live at the poverty level. That's an annual income of less than $23,550 for a family of 4. And 37% of New Mexico children have parents who lack full-time, year-round employment.
How can you help?
We need to protect funding for the SNAP program. Hunger impacts a child's brain development and their ability to perform in school. We need to raise the state's minimum wage because parents who earn a living wage are better able to provide for their children.
We're counting on you. The second domain is education.
This domain includes children not attending preschool, 4th graders not proficient in reading, 8th graders not proficient in math, and high school students not graduating on time. Here's the extent of the problem. 62% of our children ages 3 and 4 are not attending preschool. 79% of New Mexico 8th graders are not proficient in math. 33% of New Mexico's high school students do not graduate on time.
How can you help?
We need to increase general fund spending on early childhood education programs, home visiting, child care assistance, and pre-K. In addition, we need to pass a constitutional amendment to support these programs. We can do that with a small percentage of the money generated by the Land Grant Permanent Fund. This would allow us to increase parent coaching programs like home visiting, which would reduce the incidence of child abuse, improve school performance, and prevent adverse childhood events. We also need to restore K-12 per pupil funding to pre-recession levels and eliminate overcrowded classrooms.
We're counting on you. The
third domain is health.
This includes low birth weight babies, children without health insurance, child and teen death rates, and adolescents who have abused alcohol and/or drugs. 9% of New Mexico children lack health insurance. 9% of our teens have abused alcohol or drugs.
How can you help?
We need to restore outreach and enrollment programs for Medicaid for kids. We need to simplify the enrollment and recertification process. Expand funding for counselors and suicide prevention programs. Expand behavioral health for youth. And let's focus on treatment instead of incarceration for alcohol and drug offenders.
We're counting on you.
The fourth domain is family and community.
This domain is comprised of children living in high poverty areas, teen birth rate, children in single-parent families, and children where the head of household lacks a high school diploma. Here's the extent of the problem. 43% of children live in single-parent families. 22% of New Mexico children live in a family where the head of household lacks a high school diploma. 21% of New Mexico children live in areas where overall poverty is 30% or higher. And the teen birth rate is 53 births per 1,000 female teens.
How can you help?
We can restore child care assistance to twice the poverty level, so working poor parents can have child care and be able to work. Expand GED programs. Create or expand incentives for developers to build mixed income housing. Increase funding for school-based health clinics and teen pregnancy prevention.
We're counting on you.
If we can ensure that children have a good start, that they do graduate from high school healthy and ready to contribute, we know that that will build the economy, that will attract jobs to New Mexico, is having an educated and healthy workforce. And we know when we all do better, we all do better. And so we believe that this comprehensive set of solutions, there's no one single solution. It's going to take a comprehensive strategy from the legislature, from the executive, from nonprofits, from schools, city, county, all of us working together. But I believe that working together, we can make a difference for New Mexico and a better quality of life and a better future for all of us.